Hidden dangers behind sweet temptations. Is the common belief that fruits are good for your health truly applicable to all situations? Particularly when it comes to our lower body health, are they safe without exception? Looking at actual cases that occurred among seniors, aged 70 and above, the answer to this question is more complex than one might think. Do you know that fruits considered healthy can sometimes have unexpected adverse effects on our legs, feet, and lower body circulatory system? This is especially true for elderly individuals whose metabolism has slowed due to aging and who suffer from chronic diseases, requiring even more caution. What kinds of fruits and in what ways put our lower bodies at risk? Stick with us until the end of today's story. You'll learn how to lower your medical bills without needing medicine or frequent hospital visits. It could truly change the rest of your life. I've got a quick favor to ask. If you want more health secrets, please subscribe right now. Hitting like and subscribe is totally free, but the value you'll get for your health is priceless. Also, leave the number 1 in the comments below. That one click from you means so much and helps us make more videos. Don't forget to share this with someone you care about. Your personal experience could be a huge help to so many others. Grapes' sweet trap. The vicious cycle of blood sugar and edema. Mrs. Dorothy Johnson, 78, residing in San Jose, California, was particularly fond of grapes. Despite receiving an early diagnosis of diabetes, she consumed a bunch of grapes every evening, thinking that fruits are good for health. During autumn, when grapes were in season, she sometimes consumed up to 2 bunches per day. Problems began to emerge after 3 months. Swelling started to appear in Mrs. Johnson's ankles and calves, and the heavy, painful sensation in her legs worsened in the evenings. Initially, she thought it was simply a natural consequence of aging. But when symptoms persisted, she sought medical attention. The test results were shocking. Not only had her blood sugar levels risen sharply, but circulation disorders in her lower extremities had developed due to vascular damage caused by high blood sugar. 1 bunch of grapes contains approximately 23 g of sugar, equivalent to 5 to 6 sugar cubes. By consuming this amount of additional sugar daily, Mrs. Johnson's blood sugar control capacity had exceeded its limits. The doctor recommended discontinuing grape consumption and strictly managing blood sugar levels. After 3 months of dietary therapy, Mrs. Johnson's lower body swelling gradually subsided, and her blood sugar levels stabilized. However, the already damaged peripheral blood vessels never fully recovered, and she still suffers from the after effects of easy leg swelling when standing for extended periods. Bananas double threat. Potassium and sugar overload. Mr. Charles Anderson, 74, living in Miami, Florida, consumed 2 to 3 bananas daily for constipation while taking hypertension medication. He had started this habit after hearing that bananas' dietary fiber was good for constipation. He also learned that bananas' potassium was beneficial for blood pressure, leading him to consume them even more actively. However, after 6 months, Mr. Anderson faced unexpected problems. Regular checkups showed that his blood potassium levels had significantly exceeded normal ranges, and his kidney function had also deteriorated. More serious were the symptoms that appeared in his lower body. He frequently experienced leg cramps, felt weakness in his legs, and at times, even walking became difficult. 1 banana contains approximately 400 mg of potassium. The 2-3 bananas Mr. Anderson consumed daily meant 800–1200 mg of potassium, which interacted with his hypertension medication ACE inhibitor to cause hyperkalemia. Hyperkalemia causes muscle dysfunction, interfering with normal contractions, and relaxation of lower body muscles. Furthermore, bananas' high sugar content, approximately 14 g per banana, was also problematic. The daily sugar intake led to weight gain, which increased the burden on his lower body joints. Knee and ankle joint pain intensified, making even climbing stairs difficult. Following medical recommendations to discontinue banana consumption and start a potassium-restricted diet, Mr. Anderson's blood potassium levels normalized. However, recovery of lower body muscle function took considerable time, and he is still receiving physical therapy. Orange's acidic attack, the beginning of inflammation and gout. Mrs. Helen Martinez, 72, residing in Dallas, Texas, enjoyed oranges for winter cold prevention. Due to their rich vitamin C content, she consumed 3–4 oranges daily, sometimes including orange juice. She particularly preferred freshly squeezed orange juice, sometimes using 5 to 6 oranges at once. Problems began after 2 months. Severe pain appeared in Mrs. Martinez's toes and ankle joints. Initially, she thought it was worsening arthritis, but the pain pattern was different from before. Particularly, her big toe became red and swollen, causing excruciating pain even with light touch. Hospital tests confirmed that blood uric acid levels had risen sharply, leading to gout development. Oranges are fruits rich in citric acid and fructose, which can promote uric acid production in the body when consumed excessively. Orange juice particularly has a greater uric acid-raising effect due to concentrated fructose. The 3-4 oranges in juice Mrs. Martinez consumed daily contained approximately 60-80 grams of fructose. This significantly exceeded the recommended daily fructose intake for elderly individuals. Excessive fructose converts to uric acid in the liver, raising blood uric acid concentration, which then deposits uric acid crystals in toe and ankle joints, causing gout. Additionally, orange's high acidity pH 3.3-4.2 was also problematic. Persistent acidic environments increase inflammatory responses in the body, worsening inflammation in joint surrounding tissues. Mrs. Martinez's gout symptoms began to improve only after discontinuing orange consumption and switching to an alkaline food-centered diet. Raisins' hidden danger: the combination of concentrated sugar and sodium. Mr. Robert Thompson, 76, living in Seattle, Washington, enjoyed raisins as snacks. They were convenient to carry and sweet, so he always kept them in his pocket during outings and consumed them frequently. He typically consumed 2 to 3 small packages daily, sometimes even more. After 3 months, Mr. Thompson experienced serious lower body swelling. His legs, which were fine in the morning, became so swollen by evening that sock marks were deeply imprinted, making it difficult to wear shoes. Additionally, his urine output decreased compared to usual, and his weight increased rapidly. Raisins have sugar concentrations 4 or 5 times higher than fresh grapes due to the drying process. The 60-90 g of raisins Mr. Thompson consumed daily contained approximately 45 to 70 g of sugar, equivalent to 10-15 sugar cubes. More problematic was the sodium added during processing. Commercially available raisins often contain added sodium for preservation and color maintenance. The raisins Mr. Thompson consumed contained approximately 30-50 mg of sodium per 100. By consuming 60-90 g daily, he was ingesting an additional 20-45 s of sodium. The combination of high sugar and sodium promoted fluid retention in the body, causing swelling, particularly in the lower extremities affected by gravity. Additionally, rapid blood sugar spikes damaged blood vessel walls, increasing capillary permeability and further worsening the swelling. Following doctors' recommendations to discontinue raisin consumption and start a low-sodium diet, Mr. Thompson's lower body swelling gradually improved. However, complete recovery of damaged vascular function took more than 6 months. Mango's sweet trap: blood sugar spikes and inflammatory reactions. Mrs. Jennifer Williams, 71, residing in Los Angeles, California, was captivated by mango's sweet taste and consumed 1 to 2 mangoes daily each summer. She particularly enjoyed thawed frozen mangoes, frequently consuming them as snacks due to their cool and sweet taste. Problems appeared after 1 month. Inflammation developed in Mrs. Williams's ankle and knee joints, and morning joint stiffness and pain intensified. Additionally, red spots began appearing on her legs, accompanied by itching. Mangoes have extremely high sugar content among fruits. 1 medium-sized mango contains approximately 45 g of sugar, more than 3 times that of a banana. The 1-2 mangoes Mrs. Williams consumed daily meant 45-90 g of sugar, causing her blood sugar to rise sharply. More problematic was urushiol, a component found in mangoes. This substance is also found in poison ivy and can cause allergic reactions in some people. Mrs. Williams had a sensitive constitution to this component, and continuous mango consumption caused chronic inflammatory reactions. The combination of high blood sugar and allergic reactions caused serious inflammation in lower body blood vessels and joints. Inflammatory responses appeared more severely in lower body areas affected by gravity, leading to joint pain and skin problems. Mrs. Williams's symptoms began to improve only after completely discontinuing mango consumption and receiving anti-inflammatory treatment. However, recovery of damaged joints took considerable time. and she still experiences joint pain on humid days. Cherries double attack. Salicylic acid and high sugar content. Mrs. Betty Davis, 79, living in Atlanta, Georgia, began consuming cherries daily for health after learning about their antioxidant effects. Particularly when imported cherries were in season, she consumed 200-300 grams daily and also consumed cherry concentrate. After 1 month, Mrs. Davis faced unexpected problems. Unexplained inflammation and swelling occurred in her toes and ankle area, with painful symptoms appearing while walking. Blood tests also confirmed elevated blood sugar levels. Cherries are rich in salicylic acid, which is also the main component of aspirin. When consumed excessively, it can cause inflammatory reactions in some people. Mrs. Davis had a constitution sensitive to salicylic acid, and daily cherry consumption caused chronic inflammatory reactions. Additionally, cherries are fruits with considerably high sugar content. The 200-300 g of cherries Mrs. Davis consumed daily contained approximately 30-45 g of sugar, and this amount increased further with the addition of cherry concentrate. This promoted vascular inflammation along with blood sugar elevation. The combination of salicylic acid allergy and high blood sugar caused complex inflammation in lower body blood vessels and joints. Inflammation appeared severely, particularly in extremity areas, where peripheral blood vessels are concentrated, affecting walking. Mrs. Davis's symptoms improved after discontinuing cherry consumption and receiving anti-inflammatory treatment, combined with blood sugar management. However, salicylic acid sensitivity persisted, requiring her to be careful with aspirin or foods containing salicylic acid. Pineapple's enzyme attack. Side effects of bromelain. Mr. Thomas Miller, 73, residing in Phoenix, Arizona, consumed pineapple after meals for digestive benefits. Particularly after eating meat, he consumed half a pineapple daily. Having heard that pineapple aids digestion, he consumed both fresh pineapple and pineapple juice. After 2 months, Mr. Miller experienced unexpected symptoms. Persistent swelling developed in his legs and ankles, accompanied by red rashes and itching on his skin. Additionally, calf muscle cramps occurred frequently, and leg numbness at night prevented proper sleep. One of pineapple's main characteristics is its abundance of bromelain, a protein-digesting enzyme. While this enzyme aids digestion when consumed in appropriate amounts, excessive consumption can damage blood vessel walls and tissues. The pineapple Mr. Miller consumed daily contained considerable amounts of bromelain. Bromelain increases vascular permeability, causing fluid to leak from blood vessels into tissues. This phenomenon appears more prominently in lower extremities, affected by gravity, causing swelling. Additionally, it can cause allergic reactions in some people, resulting in skin rashes and itching. Furthermore, pineapple's high acidity pH, 3.2-4.0, and sugar content approximately 35 g per pineapple were also problematic. Acidic environments promoted inflammation, and high sugar content intensified vascular damage, along with blood sugar elevation. Following medical recommendations to discontinue pineapple consumption and receive antihistamine treatment, Mr. Miller's lower body swelling and skin symptoms gradually improved. However, sensitivity to bromelain remains, requiring him to avoid foods containing pineapple. Conclusion: fruits also walk the fine line between medicine and poison. Through these examined cases, we can derive important lessons. The general belief that fruits are healthy does not apply to all situations, and particularly for the elderly population, a more cautious approach is necessary. Changing metabolism with aging, interactions with medications being taken, and the presence of chronic diseases are all important factors to consider when consuming fruits. Particularly, the lower body is directly affected by gravity, so the effects of blood sugar elevation, inflammatory reactions, and electrolyte imbalances can appear more distinctly. Therefore, it is important for the elderly to follow these principles when consuming fruits. First, appropriate amounts must be maintained. No matter how healthy a fruit may be, excessive consumption can become toxic. Second, individual health conditions and medications being taken must be considered. Third, when trying new fruits, start with small amounts and observe bodily reactions. Fourth, if symptoms appear, immediately discontinue consumption and consult with medical professionals. Most importantly, we must move away from the simple formula of fruits, health, and adopt a balanced perspective. By enjoying the health benefits of fruits, while recognizing potential risks and consuming them wisely, we can more effectively protect not only our lower body health but our overall health as well. Thank you for watching.